Good evening, everybody. I'm Dr. Radhika Balu, and as Keith has actually elaborated so much, I'm a very simple GP who like looking after actually patients in general practice. And thank you for inviting me to talk about flu vaccination and diabetes now. It is, I'm just going to give you a brief introduction to what it is that that we're trying to do in NHS now, and then yes, you can ask me any questions about it. As you know, as Keith was actually talking about earlier, I have always been, interested with my patients with diabetes itself and how we can improve their life expectancy and also their quality of life. What I had, just before I start, I wanted to actually start with this. The reason why I became interested was I've been working at the COVID hub since the start, say the March 18th is the date that I remember. So every day I've been working there and had taken a step back after the first surge, and again, I'm just jumping back in for the second surge. What I noticed initially before we recognized all these what was happening to patients with diabetes is the amount of admissions that we had and the amount of admissions that we had for our Asian patients, especially between the ages of 50 to 64, living with diabetes, getting admitted. That's where we did do actually something radical. What we did was we had some diabetic specialists who went into every surgery, made sure that there was messages sent to every patient in every surgery. And we also made sure that their diabetes control is much better. Now, having come to what we, in Harrow, I'm working in Harrow, which as you know, has a lot of BAME population. And our prevalence in Harrow for diabetes is the highest in the whole of the country. So having done all this, we are coming to the flu vaccination and why are we driving this flu vaccination? So the flu vaccination, every year we do the flu vaccination. We vaccinate about, say, the last year's figures for patients with diabetes and flu vaccinations are about 61%. That is for the whole of the diabetic population between the ages of 2 to 200, whoever that we can vaccinate. Is about just 61% that we vaccinated last year. And the percentages will vary with each cohort. Why now? The reason behind that is, as you know, we are expecting a second surge. We don't know how the second surge would be. The same kind of population would be affected with the flu as well. And we want to prevent the hospitalization and the complications for patients with diabetes this year. That is the main reason for it. And the government's drive is to at least achieve 75% vaccination for all patient cohorts. So it's not just about our vulnerable population, it's also about patients about young children, so that we can prevent the transmission of the flu virus to the other patients within the household and also within the community. So let's take a step back. What is it that we talk about the flu virus? The flu is caused by a virus rather than a bacteria. And there are about 4 types of viruses that we have. And what we usually worry about is the 2 types of strains, which is the A and B. And what does it do? It does go and reside in your lung linings. So for somebody who's healthy, you will get a flu-like illness. What do we say? You'll have fatigue, you'll have fever, you'll have sore throat, a stuffy nose, and you'll feel tired. You'll generally be better within 2 to 7 days. In patients with underlying health conditions, so if you have a heart disease, if you have renal disease, if you're a patient with diabetes, if you've undergone cancer, or if you're undergoing cancer treatment, or if you're on special medications which can weaken your immune system, your response might be varied. Not that you will end up with complications all the time, but there is a higher chance of you getting complications. What do we mean by complications? It's usually, we are talking about pneumonia, which is caused by a bacteria on top of that virus. And that can lead to hospital admissions and probably a stay in the hospital or needing antibiotics, something like this. And that is what we want to prevent. And what do we do with that? So we have developed vaccines. And how do the vaccines come about? The World Health Organization looks at the virus that's circulating in the community all over the world. And then it does a prediction and tells us this is the actually strain that you will get during this winter, which is between November to actually, for us, it starts around September, October time, and it goes until March. So this would be the strain that you would have. This would be the A virus and the B virus. And then what we are supposed, and what the vaccine producers do is they manufacture the vaccine and we give the vaccines out. So with the vaccine, how much will it protect you? Is it 100%? Nothing is 100%. It protects about 30 to 60%. That's the maximum that it can do. And even for over 65, it's even less. But what we definitely know is you tend to actually reduce, we tend to see a reduction in people who've got the flu vaccine with them actually presenting in the hospital or actually having, admissions in the hospital. So that's something that we want to do this year. And people usually ask me, doctor, it doesn't work for me. If I have the vaccine, actually, I get the flu once I get the vaccine. So why should I have it? So, but what you should remember is the vaccine doesn't actually contain, there are two types of vaccine. One is what we call as the live vaccine, which contains a tiny bit of the live virus, but it is actually, it's so actually derived in such a way that it doesn't actually cause the flu. And that's a vaccine given to children in the form of nasal spray. The other vaccine that you have got is actually inactivated vaccine. So it's just vaccine parts rather than the live virus itself. And you tend to find that you don't get the flu with it. Yes, you might feel tired. You might have some joint pains and aches. You might get a little bit of actually, a reaction around the site for 1 or 2 days, but it doesn't cause the flu. Why do I catch the flu when I get the vaccine? Probably because it's a coincidence that you're coming to the same place and somebody else has had it, and you're actually, it's just happens that you catch the virus at that time. So this is, and for me, what I would say is it's more about, yes, protecting yourself. For patients with diabetes, it's about protecting themselves, because being ill during this COVID crisis and presenting to hospital is not a great thing. And also, when you're a patient with diabetes, there is also other measures that you need to take. Say, for example, we talk about sick day rules. We talk about actually, what to do to prevent actually complications and kidney problems and stuff, AKI and stuff. So what I would say is, let's all take that opportunity and get vaccinated as much as possible during this immunization drive. And I'm open to questions. Thank you, Keith.
Thank you very